Some diabetes pills combine two medications in one pill. These combination medications treat more than one cause of type 2 diabetes, giving you greater control of your blood glucose. The combination pills Avandamet, Actiplus Met, and Actiplus Met XR help the cells of your body become more sensitive to insulin, and over time, help keep your liver from releasing too much glucose into your bloodstream. To see how these medications work, let's look at how diabetes affects the way your body uses the food you eat. Most of the food changes to glucose, a form of sugar. Glucose enters the bloodstream, causing your blood glucose level to rise. In response to this rise in glucose, the pancreas releases insulin. Insulin works like a key to open the cells and let glucose enter. The glucose is used for energy now or stored for later use. As insulin works to move the glucose out of your bloodstream and into the cells, your blood glucose level drops. However, your body still needs glucose for energy. To keep your blood glucose from dropping too low between meals, your pancreas releases glucagon. Glucagon triggers the liver to release stored glucose to be used for energy. In many people with type 2 diabetes, the cells have trouble taking in glucose because they can't use insulin. This is called insulin resistance. At the same time, the liver releases too much stored glucose. Both cause your blood glucose level to stay high. Avandamet, Actiplus Met, and Actiplus Met XR help your cells use insulin to open and let glucose in, and also keep your liver from releasing too much glucose into your bloodstream. These medications are generally taken once or twice a day with meals. Some common side effects include hypoglycemia, also called low blood glucose, diarrhea, nausea, and abdominal pain.
Do you have an active job?
Avandamet can cause life-threatening side effects. It can increase your risk of serious heart problems, including heart attack and stroke. If you are taking Avandamet, be sure you understand and review your heart disease risk factors with your healthcare provider. A different medication is most likely safer for you. If you do have any side effects, let your diabetes care team know about them. However, do not stop taking your diabetes medication unless you are told to do so. The health of your liver and kidneys should be checked before you start taking these medications. These medications can increase your risk of a serious condition called lactic acidosis. You are more likely to develop lactic acidosis if you have certain health conditions or drink large amounts of alcohol. If you drink more than 2 to 4 alcoholic drinks per week, tell your healthcare provider. A different medication may be better for you. You may need to temporarily stop taking these medications before having medical procedures using contrast dyes. People with congestive heart failure should not use Avandamet. There may not be one single reason why your blood glucose is high. So taking a diabetes medication that combines 2 treatments into one pill can be beneficial to you, your blood glucose, and your overall health for the future.